past, the first time that we will come together as a community to talk about issues and concerns as PWDs together with our families and advocates of our cause. I am really overwhelmed by the participation of various organizations representing the different subgroups of PWDs today. This indeed shows not only the interest, but more so the commitment of so many to uplift the conditions and life of our sector. Today, you are going to hear the initial measures that the P3PWD intends to pursue. And we also hope to be able to hear from you your concerns as well. I could see that this is just the beginning, and we hope to be hearing all your concerns later today. I hope to see, however, though the challenges ahead of us are tremendous, we are encouraged that we are not alone, that together with you, we can do something to bring hope, to put into law and practice critical measures that can plug the gaps and give PWDs what they really deserve. The opportunity to step out into the society and play an active role, to live a life of dignity and to hold their heads high up, just like anyone else. So this afternoon, I look forward to a productive meeting with all of you and looking to working with all of you also in the future for our dear constituents. Maraming salamat po.
Thank you very much, Ma'am Grace. We are very happy to hear you today. So, yes, and we are looking forward to an active P3PWD supporting the P3PWD party list office of Congresswoman Gwanson. Thank you very much po. Okay, so we would like to go through dito sa ating agenda for today. Saan na ba yung agenda mo? Yung agenda lang naman po natin, which is a very important part, is magkakaroon lang po tayo ng discussion about the proposed bill on National Rehabilitation Act, which is hindi pa po siya talaga buo as a bill. Nagkaroon lang po tayo ng concept note, at ito po ang magiging working draft natin para pupunuin natin at kukunin po natin, because alam naman po natin na ang rehabilitation ay hindi po concern ng isang disability lang. Lahat po ng disability ay nangangailangan ng rehabilitation. At bago po yan ay update po namin kayo, ay nakapag-file na po si Attorney Gwanson ng dalawang bill, yung PWD Empowerment Bill at saka po yung Disability Support Allowance Bill which seeks to provide at least 2,000 peso disability allowance for persons with disabilities. So, ito po. Naglagay po ako ng kopya doon sa ating group chat about disability allowance bill at saka yung PWD empowerment bill. Yung PWD empowerment bill seeks to establish Disability Support Fund to support the development of programs and services to be given by be initiated by organization of persons with disabilities, NGO, and other interested parties who are willing to provide disability support services for persons with disabilities, like yung mga personal assistance, sign language interpreting, guides, and all like with mga human assistance needed by persons with disabilities. So, at dito po sa bill na to ay it's eyeing the strengthening of the National Council on Disability Affairs as a commission, and to have a regional presence so that they can monitor the development of this of disability support fund, which also change the commission's representative coming from the different sectors of coming from the different groups of the disability sector, which includes persons with different types of disabilities, children, organization representing children with disabilities, parents, yung mga parents organization, then yung mga all stakeholders, hindi lang po mga from the sector. So, yan po yung hopefully kapag po ito ay fully accepted ng House, ay magkakaroon na po ng deliberation. Kaya hindi pa po natin pwedeng i-publicize itong bill na to, kundi ito ay para po lamang dito sa consultative group na pag-uusapan natin dahil alam naman natin na matagal na tayo lahat sa sektor at alam halos sa lahat tayo ay alam natin kung ano yung mga gaps na kinakailangan para ito ay para mabuo natin talaga yung hinahangad natin na inclusive society for all. So, now I'd like to go to the discussion of the gusto po ba natin ipapabasa muna natin itong ating ito. I'll share my screen again for you to see. Dahil ito po, hindi naman po natin pakakahabaan ng discussion dito, no? Kundi ating yan po. Siguro I'd like to do this. Yan po.
Republic of the Philippines. House of Representatives. Quezon City, Metro Manila. 19th Congress. First Regular Session. House Bill No. ______. Introduced by Representative Ma. Rowena Amelia V. Guanzon. An act providing for the National Rehabilitation Program for all population in all stages of life course and making rehabilitation as an essential health service and crucial for achieving the universal health coverage. Explanatory note. Globally, 1 in 3 people is living with a health condition that benefits from rehabilitation. These needs are spread across the lifespan, from children with congenital and intellectual impairment, to young adults with physical limitation resulting from unintentional and war-related injuries to older people experiencing chronic disease or difficulties associated with aging. These rehabilitation needs will only grow in the coming years as populations continue to age, and the number of people living with chronic disease continues to increase throughout the world.
Maliwanag po ba? Naririnig naman?
Yes
Any
po.
feedback? Okay po, malinaw.
Yes,
So,
Ate Carmen. Naririnig.
okay, sige po.
Yes
So,
po.
okay, good. May hindi lang naman po ito. And then, as we go along with our reader, pwede nyo pong i-take note yung mga areas na meron po kayong gustong i-elaborate, gusto nyo ipasok, o gusto nyo na basin mga recommendations sa mga areas na pwede po nating i-enhance o ipaliwanag ay dahil yung concept po kasi dapat maliwanag ito para po mas magawa natin ito ng maayos na mga mga policies. Okay po. Okay lang po ba, Sir Ching? Naririnig po?
Okay.
Okay po. So we'll go ahead.
Many countries, like the Philippines, are not equipped to respond to existing rehabilitation needs, let alone the forecasted increase that is arising from health and demographic trends. Rehabilitation is often not prioritized in countries and continues to be under-resourced. As a result, countless individuals do not have access to rehabilitation services, leading to an exacerbation of their condition, further complications, and lifelong consequences. In some low and middle-income countries, more than 50% of people do not receive the rehabilitation services they require. Findings from the study of the Council for the Welfare of Children in 2020 revealed that children with disabilities who have no access to habilitation and rehabilitation services accounts to 49%, and 43% have no access to general health services. No data is available about the 12% of population, 15 and above, who were estimated to be living with various forms of disabilities from moderate to extreme, needing rehabilitation services and appropriate assistive devices to increase their functionalities. Rehabilitation does not gain much popularity of limited services and providers available, especially in geographically isolated, disadvantaged areas, where a bigger percentage of persons with disabilities are living. Rehabilitation is invisible in the public health system, and no unit within the national health structure ensures that all citizens in all stages of life will avail of services. It is always a part of the hospital, which makes rehabilitation inaccessible for the largest number of people needing them. The impact of this gap in the healthcare system is huge, which results to the following. Absence accessible, affordable and acceptable early intervention program to children with disabilities, especially those identified by the newborn screening, and for people with acquired disabilities, temporary or permanent in nature, especially for stroke survivors and with neurodiverse conditions. Acquiring secondary disabilities and decreasing of functionalities because of limited or without rehabilitation services, especially those identified by the newborn screening, and for people with acquired disabilities, temporary or permanent in nature, especially for stroke survivors and with neurodiverse conditions. Access to appropriate assistive devices, because of lack of consultations with rehab professionals. Because of this gap, there is limited availability of quality appropriate assistive devices at cost not within the reach of common people and denied by government assistance programs because of ignorance on how it will increase the functionalities of persons with disabilities. The PhilHealth Smorf package is available for amputees who want to avail of low-cost prosthesis and orthoses for an allocated amount of P30,000. A quality prosthesis usually costs $60,000 to $200,000 or more. There are few accredited providers, which were mostly not within reach of people from several regions. the expanded ZMRPH package for children and youth below 18 is also available and could be a great help for children needing all types of rehabilitation and assistive devices, but there are only 5 or less accredited providers of rehabilitation services that parents from far-flung regions are left with no choice but watch their children's functionalities to decrease and increase the barriers for them to go to school in regular classrooms. People with psychosocial disabilities have nowhere to go in times of breakdown, leaving their family members helpless as they wander on the streets and disappear. Mental health programs and facilities are nowhere to be found in local government units who do referrals to the only center for mental health in the country just to get rid of a problem they cannot solve. Rehabilitation professional brain drain is so evident because of ignoring their roles in contributing to building a strong workforce. The evidence is the absence of regular positions for rehab professionals at the local health structure. The goal of this act is to address the following by taking actions to create a unit within the Department of Health to provide strong leadership and gain political support in establishing a strong rehabilitation program for all people, prioritizing the need for comprehensive programs, facilities and incorporating rehabilitation in universal health coverage. Build a comprehensive rehabilitation service delivery model to progressively achieve equitable access to quality services, including assistive products and technology for all population, including those in rural and remote areas. Develop a strong multidisciplinary rehabilitation workforce that is suitable for country context and promoting rehabilitation concepts across all health workforce education. Expand financing for rehabilitation through appropriate mechanisms. Amend Chapter 3, Section 19-20 of Republic Act 7277, which states: Sector 19. Rehabilitation Centers. The Department of Health shall establish medical rehabilitation centers in government provincial hospitals and shall include in its annual appropriation the necessary funds for the operation of such centers. The Department of Health shall formulate and implement a program to enable marginalized disabled persons to avail of free rehabilitation services in government hospitals. Sector 20. Health Services. The state shall protect and promote the right to health of disabled persons and shall adopt an integrated and comprehensive approach to their health development, which shall make essential health services available to them at affordable cost. The national government shall provide an integrated health service for disabled persons, which shall include, but not limited to, the following: prevention of disability through immunization, nutrition, environmental protection and preservation, and genetic counseling, and early detection of disability and timely intervention to arrest disabling condition, and b. Medical treatment and rehabilitation. The Department of Health shall field medical personnel specializing in the treatment and rehabilitation of disabled persons to provincial hospitals and, when viable, to municipal health centers. It shall also train its field health personnel in the provision of medical attention to disabled persons. It shall further ensure that its field health units have the necessary capabilities to fit prosthetic and orthotic appliances on disabled persons. Amendment should include: DOH shall develop a structure and staffing pattern to monitor the establishment of rehabilitation centers for provincials, district and city hospitals for adoption of all local government units, including the creation of Rehabilitation Referral Unit in Persons with Disabilities Affairs Office in all local government units. Amend Republic Act 11228 Section 20A second paragraph states that the PhilHealth shall develop exclusive packages for PWDs that will address their specific health and development needs. The expanded ZMORPH package for the rehabilitation of children with disabilities is an example of an initiative that PhilHealth should be doing to finance the rehabilitation needs of children with disabilities. Even if there is financing, it is also deemed useless because of the absence of service providers. RA 11228 stated that PhilHealth shall develop accreditation guidelines for non-hospital-based providers of rehabilitation services, which could be useful for the expanded ZMORPH package for children with disabilities. To seal the role of PhilHealth in financing the rehabilitation services for all people, there has to be a provision mandating the participation of civil society organizations, to include organizations of persons with disabilities, rehabilitation professionals, parents of children with disabilities and with neurodiverse conditions, as members in the PhilHealth Board. Section 2, which states that, towards this end, the DOH shall maintain an updated database on PWDs and their health and development needs. The LGUs, the agencies are directed to submit their data to the DOH. The contributions for mandatory membership of persons with disabilities to PhilHealth was not budgeted for 3 consecutive years because of DOH to upload the database of persons with disabilities from the local government units. PhilHealth has better data management structure and expertise in terms of handling big data, and they have presence in all provinces, cities, and municipalities nationwide. For the purpose of proper implementation of RA 11228, PhilHealth should use their existing procedures in enlisting persons with disabilities within their system at the LGU level. Providing tax incentives for importers/local distributors and manufacturers of assistive devices and technology. Discussions on suggested provisions of the bill.
Okay. Salamat po. Okay po. So, marami tayo ditong mga ano, no? So far, ito yung mga concerns about the bill and to include amendments of laws, mga existing laws na pwede nating isama sa rehabilitation dito sa act na to. Siguro andito pala si Doktora Bundok. Maybe we can request her to provide us a background and explanation about the expanded CMOR package, yung rehabilitation package for children with disabilities. Doc?
Hello, good afternoon. Thank you, Carmen. Oo. Very good na kasama.
Makita?
Ay, magpapakita ako. Okay. Ayan. Hello, magandang hapon sa lahat. Maraming salamat dito sa initiative na to. Oo, na nating lahat. Oo. Ano lang po, sa ngayon, ang packages po ng PhilHealth, meron tayong adult, meaning po 18 years old and older. Nagko-cover po nito ang below knee prosthesis lang. And yung po yung Z-morph. So below knee prosthesis lang siya. Tapos in-expand po ito to expanded Z-morph, which covers all levels of amputations, whether po upper or lower extremity, at saka all levels din ng limb deficits, na weakness or paralysis, whether upper or lower extremity, saka sa spine. And this is for 18 years old and above. Idinagdag din dito, aside from the devices, ang rehabilitation sessions. So binabayaran yung rehabilitation sessions related to the functional and safe use of the device. And then yung pangatlo is the children with disabilities. Ito yung for less than 18 years old. Ang covered nito are all impairments related to mobility. So ito yung prosthesis, orthosis, wheelchair, sitting devices for the less than 18, vision, optical and non-optical aids, hearing, so hearing aid, and then developmental. So, hindi lang devices ang kasama dito, kasama rin ang diagnostics, kasama din ang rehabilitation sessions. So, hiwalay pa yung sessions related to the device, kung mobility, vision, or hearing, at may hiwalay pa, may entirely separate package kung purely rehabilitation sessions lang ang kailangan. What is actually pending in PhilHealth right now, which they hope to pass the circular before the end of the year, is the adult rehabilitation package. So para siyang adult version of the children with disabilities, which will now include rehabilitation sessions. Ganon din siya for mobility, for vision, for hearing, and then cardiopulmonary, yung other impairments kasama na doon. And this will also include rehabilitation sessions, diagnostics. So hindi pa ito nagagawa ng circular. So currently, ang ating mga challenges are pag pumupunta, tama yun, no, nakalagay doon sa nakasulat na recommended law, na kokonti ang mga hospitals na nagsisik na maging contracted ng PhilHealth for this for these packages. And the factors cited were their hospitals do not have the infrastructure. Number 2, walang nag-a-apply na manpower. Ang pinakamahirap makuha is our speech therapists and occupational therapists. Tapos, ang number 3 din na nila is actually access. How they cannot access the hospitals kasi so far, yung PhilHealth packages are only limited to tertiary. So pag sinabi na tertiary, ito yung nasa, kunyari PGH, nasa mga urban areas ba? So kung malayo ka, hindi mo maaabot. Number 2, na problem ng PhilHealth is usually persons with disabilities, as they understand the mandatory membership, pag pumunta sila sa isang facility, dala lang nila ang PWD ID nila, PhilHealth member na sila. Okay? So which is not the case. Kailangan may PhilHealth number pa rin sila. So kailangan kahit may PWD ID ka, enrolled pa rin sa PhilHealth. So yun yung isang very frustrating for our persons with disabilities. So kulang pa o halos walang education pertaining this or the implementation yung mandatory membership. Ang third is actually within PhilHealth itself. Currently, yung kanilang encoding system for children with disabilities hindi pa nagagawa. So, nagkaroon ng problema niyan kasi the hospitals will accept children with disabilities who would need the packages but they cannot be paid by PhilHealth kasi walang encoding system pa for reimbursement ang PhilHealth. So din, no? Parang one of the reasons why healthcare facilities are hesitant to become contracted by PhilHealth. And then number 4 din would be hindi integrated sa health system fully yung PhilHealth package. Yung mga enablers ba para maka-avail yung ating mga persons with disabilities ng PhilHealth package are not there. So, sinuggest ko nga kung pwede isama dito sa act na to yung mga enablers to access transportation kasi hindi to binabayaran ng PhilHealth transportation to the health facility, the meals, the allowances, and minsan kasi para magawa yung device, they have to stay 2 weeks para hindi na sila pabalik-balik. So baka hindi ko lang alam kung paano rin natin ito maipapasok doon. So far, yun po yung status noong mga PhilHealth packages. Maraming salamat.
Okay, thank you, Dr. Ateni, for that semi-comprehensive explanation about the Zipmore package. So,
dapat mute.
Yes.
Okay.
Sino po? Ay, wala, kala ko. So, meron pa po bang gustong ng information about ano po ang status ng ating mga ibang kasi ang parang nakikita natin dito no yung lack of manpower.
Yeah.
So yes po. Pakilala. Nahanap ko po kayo. Sino po?
Commissioner Gordon. Big thanks. Pwede magpa-picture. Thank you.
Sino po? Sige po, go ahead. Pakilala lang po.
Piaching.
Searching. Sige. Go ahead, searching. Naka-spotlight ka na.
Narinig po ako?
Yes po.
Ang comment ko lang dyan kasi hindi nagiging effective. Walang mga hospital na tumatanggap because how do we maybe we should this that kasi reported before na yung mga COVID patient na yung deadlift government hospitals being paid. The paper is there, no? So we can do that. What can we do to address that problem, Ma'am Carmen, di ba? Because they
Happy ka, Kuya Ching. Hindi ka masyadong, hindi ka masyadong,
I suggest tanggalin mo muna yung video. Here, voice nyo.
okay. Ano po yung gusto nating i-address sa searching?
problem about hospital being paid. I think that before, di ba, na parang pinabayaran yung yes. The problem is there, no? So for this yun, namit na. May background. Ay,
Medyo choppy.
somebody maingay.
Okay. Go ahead, searching.
I think we should address the problem of payment to hospitals.
Yung
Yes.
hospital payment. Okay po.
That is why maybe we are not enjoying fully the PhilHealth benefits because hindi nga din sila nagbabayad sa mga hospitals. Walang mga hospitals na willing to join the program, di ba po?
Okay po. Yan. Yung mga accredited, yung mga kasi ang sa when we talk about rehabilitation, hindi naman po lahat dapat hospital-based. But for now, ang mga ina-accredit ng PhilHealth ay mga hospital-based. So, doon sa RA 11228 ay nakalagay doon na ang PhilHealth shall accredit, shall come up with the guidelines to accredit non-hospital-based service providers. So, yan po yung inihintay natin.
I think it was mentioned by Dr. Penny kasi a while ago na kulang nga yun nag-a-apply. And maybe because
No,
yun nga.
walang nag-a-apply na non-hospital days kasi wala pa silang guidelines doon. At kahit may nag-apply, hindi naman nila pwedeng i-action dahil wala silang guidelines.
Okay.
So, yun po ang hinihingi natin sa PhilHealth na ilabas na yung guidelines at start accrediting non-hospital based sa rehab providers. Okay po.
Okay
So,
po.
yun may tanong lang po ako sa ating mga rehab groups, no? Yung isang goal kasi natin is to create a unit within the Department of Health to provide a strong leadership and gain political support in establishing a rehabilitation program for all people. So, wala po bang branch ang DOH na talagang nagpo-focus sa rehabilitation?
Ate Carmen, Dr. Sembrano po, may I speak?
Sure. Sino to?
Okay, this is Dr. Zambrano, Philippine
Ay, Doc
Orthopedic.
Santi. Oo, sige.
Okay, ay ma'am. Kumusta naman? Ngayon ulit tayo
Sige.
kita. Okay, ma'am, ano lang po, I just want to clarify on certain matters with regards to the DOH. What is currently happening is that because of the Universal Healthcare Act, the Philippine Orthopedic Center was designated as a national specialty center for rehabilitation besides orthopedic. So dalawa po dito. We have been in with DOH collaborating on creating the standards, stats policies that will be handled by the national specialty centers. Ma'am, we initially had included some of the regional hospitals, and we also have identified subnational hospitals. But the project will not entail only the hospitals, but we are looking into going to the rural healthcare units, pati yung sa LGU na RHU. We are looking into that pagdating namin sa phase 2 kasi syempre hindi naman agad magawa sabay-sabay nun. Currently, we are also looking for ways to upgrade all infrastructure of the different hospitals, also increasing the manpower plantilla items. So yun yung mga medyo nakatrust sa amin ngayon, and we have been in coordination with the DOH kasi sa amin po binigay ang trabaho na iyan. Monitoring of different hospitals will also be done by POC, Department of Rehabilitation Medicine. That's why initially I wanted to talk with NCDA about this kasi syempre hindi naman po pwede kami lang po ang mag-uusap nito, but also we have to look into other stakeholders as well. Other things that we found out that the biggest issues, it's not just simply the Z-morph. I've talked to the various people in PhilHealth. Initially, they said that within this year lalabas yung circular. But unfortunately, again, they told me that it might come out early next year because they have to start the whole system for PhilHealth. Yung sinabi ni Dr. Bundok, this coming August pa daw nila talaga matututukan kasi meron pang ibang packages pumasok that were initially identified as prioritized, although rehabilitation is also being prioritized right now. We have already mentioned with DOH that the problem of non-prioritization of rehabilitation services by different hospitals. It's mainly because may plantilla item walang gustong mag-apply. Although physical therapy madali, medyo dumadami, but right now bumibilis na naman ang deployment in other countries. So the turnover rate also increases. The same thing with occupational therapy. We are very happy that some occupational therapists are now going into public service. No, that is very nice from them. No, kasi before it was really hard to get from OTs to go into the hospitals. And also, of course, the speech meron na rin naman, no, na gusto mag-apply. But again, I've been coordinating also with some of the speech therapy people regarding that para lang ma-assist ng ibang hospitals na magkaroon ng therapy ng tao. Orthoprosthetic people also, because as Dr. Bundok had already helped established one of the PNO schools in the country. While we are still lacking people, we are still lacking a lot of this equipment that are needed. It's not necessarily that all equipment for orthotics and prosthetics be very expensive. Kasi syempre meron din naman po tayong meron pa rin naman nagagawang mga prosthesis na abot kaya, and because of Z-morph, paminsan naging na-assist, no, na bababa yung presyo. With regards also for mental health, I think the one that are handling for rehabilitation for mental health is psychiatry. I think nasa kanila. Yung sa amin lang po ay talaga physical rehabilitation, and kasama na rin po talaga sa aming plans, no, not necessarily sa amin, but the plans includes also the deaf or the hearing impaired, sorry, or the visual impaired. So kasama na po talaga sa aming inaayos na hopefully majority of the hospitals are able to have like low vision clinics or audiology clinics para naman kahit paano ma-improve. And lastly, we are through the rural healthcare, we have in our plans already is the reintroduction. No, we really want to tell it's reintroduction of CBR to the communities because apparently there are only a few people na are just doing CBR na parang nawala dahan-dahan, lalo na nag-COVID, parang halos nawala sila. So yun lang po ang aming
So, ang question rin na, Doc, kasi di ba, yung Philippine Orthopedic Center, which you said ay ano ba ang mandate niya sa rehabilitation? Kasi when we say create a unit within the DOH to provide strong leadership, it doesn't only mean na yung hospital-based rehabilitation ang kalalakas niya.
Parang ang ginawa kasi sa amin, ma'am, parang inassign sa amin ang assistance to create the policy making with regards to that under kay Yusek David. Parang doon pa rin kami sa Health Facilities Development Bureau. So, ang alam ko kasi as of the moment, wala ako talaga nakikitang rehabilitation. Pero ito, because of that, naging kami na yung parang nagtutulong.
Yes. So, do you think, pwede nating dagdagaan na ang mandate ng POC para siya yung maging unit na talagang mag-establish ng leadership when it comes to rehabilitation.
Actually,
ano pa yung pwedeng idagdag?
Actually, ma'am, yan yung mga isa sa mga pinaplano ng department before to have full mandate because syempre kahit ibigay sa amin ng DOH kung hindi naman talaga depende sa secretary kung nawala yung ibang secretary magpapalit.
Gagawin nga nating batas yan kasi pag naging batas yan, walang pwedeng humarang. Kaya nga ilalagay natin siya sa law ng National Rehabilitation Act.
Okay naman po sa amin.
So siguro, assignment mo, Doc,
Nasaiman.
Assignment mo, itong unit na to, gawaan nyo ng terms of preference para makita natin, tapos i-compare natin. Para yun yung ilalagay natin na magiging role ng unit within the DOH to provide strong leadership in the rehabilitation. Kasi marami pa kayong gagawin. Halimbawa, yung pag-establish ng mga rehab unit sa mga hospital. Ang Magna Carta is 1992. Yung mga district, mga provincial hospital,
din nga, ma'am.
hindi nagawa ng staffing pattern yan. Kaya yan yung malaking role nitong unit na to.
Yes, ma'am.
Kasi you will make rehabilitation available, affordable, and accessible to all.
Yes, ma'am. Precisely why we're constantly having a meeting with DOH, especially the staffing pattern. A lot of hospitals, we have noticed, no, may mga units naman po yung iba, pero ang binibigay sa kanila ay isang 40 by 60 meters na kwarto. Pinagsama-sama silang lahat. So para nangyari isang plint tapos hindi naman kailangan palakarin ng pasyente, hindi makalakad kasi mas marami plint. Yung mga tipong ganon. So ang nangyayari, hindi siya conducive. So we were tasked in fact to inspect all facilities to check into that.
Yes, kasi ang gagawin yung policy, dapat yan ay address sa mga local government unit.
Yes, ma'am.
Policy advisory kayo, and then you will, itong policy na to, na ito yung dapat gagawin ng mga local yung mga LGU, provincial, district, and city
Yes, ma'am.
hospital.
Yes, ma'am. Kasi kaya nga, ma'am, the DOH is also looking into quote-unquote sponsoring
Yes.
provincial and district
O,
hospitals
sige.
and
Ang gagawin natin ay
kaya nga sabi ko malaking trabaho.
Dito ka daw sa goal number 1, you create a unit. Ito yung kasi ito yung ilalagay natin as per sa provision ng ang National Rehabilitation Act. Kaya dapat kayo mismo mag-explain ano dapat itong unit na to.
Mhm.
Ano dapat ang role. Yan.
I probably will talk to the DOH about
Yes,
that.
yes. Pero kahit wag mo lang yung kasi ilalagay natin siya sa bill. So, yan yung tapos ang kasunod niyan ay build a comprehensive rehab service delivery model.
Nga ba?
Yung number 2, di ba?
Actually, ma'am, nakagawa na kami ng stratified resource framework for that.
Oo, yan. So,
Yun na po yung maandar
yan ang ilalagay mo na yan dyan. And then develop strong multidisciplinary rehabilitation workforce. Yan, kaya mahihirapan
Actually,
kasi kulang ang workforce nyo.
that is the current trust right now, which is the staffing and plantilla item creations. Kasi nga ang dami. Like for example, we're looking into we're trying to andito yata
Pero we are not only talking about physical rehabilitation, lahat yan.
Kasama siya, ang trust namin, ma'am, is basically DOH and then going down towards the provincial.
Oo, lahat
Kasi
ng
kami sa provincial.
lahat ng disability yan.
Actually, kaya nga ma'am, hanggang rural health center, binigyan na namin ng role. Pati
Kasi,
rural health. Primary.
Kung yan, kung POC yan, orthopedic lang yan Baka magkaroon tayo ng misconception na ortho lang ang rehabilitation.
Ma'am, precisely why is although it is the National Specialty Center for Rehabilitation Medicine, actually marami na rin po dito sa amin pumapasok na non-orthopedic cases for rehabilitation. So hindi naman lang po talaga orthopedic lang po ngayon ang handle namin.
Yes.
Okay.
And kasi hahanapan tayo ng mental health, hahanapan tayo ng
Yung nga, and precisely why I mentioned about mental health being handled by the psychiatry group kasi parang doon sila ang rehabilitation, parang sila na yata mag-handle ng portion na yun.
Yes.
Yung sabi sa aming stratified framework.
Okay. So, ayan. So, anything from the neurodiverse disabilities, ADHD, autism, cerebral palsy, and other other disabilities.
Carmen?
Yes, please. Oh, may mga naka-raise. Ayan, si Ms. Mona, go ahead.
Okay. So, like Doc,
okay, come on,
yes,
Ms.
si
Mona.
Doc Penny po nag-articulate na ma'am about the difficulty that we have had in our community to avail of the ZMorph package. Basically, hindi po nangyari yun. Also, aside from that, the other government sources which used to provide assistance, for example, the PCSO, it was also taken away.
Yes.
So essentially, at this point, there is no recourse for our parents to source government funding if ever their location is in a place not serviced by an existing service provider. So yun po, I think it is now very critical for us to define the path forward for the government to help in our habilitation. With regards to the language of the proposed House bill, we would be very appreciative if we use habilitation, not just rehabilitation, in the language of the law. Yun lang po, ma'am.
Okay, yeah, that is kasi we are yung reference kasi natin yung Rehab 2030 ng WHO, wala siyang habilitation. So I guess we have to put it, to make it original. Yes. Thank you very much, Miss Mona. Yes, Doc Purge. Then susunod si Candice and next is Chrissy. Okay, go ahead, Doc Purge.
Thank you, Ma'am Carmen. So di ba pinaka-question niyo po is yung first ay, do we agree about having a rehabilitation unit in DOH?
Yes. Yes.
And I think it would be a good initiative kasi nga, di ba, for the past few years, medyo nahihirapan kung yung program, di ba, nagkaroon tayo ng health and wellness program for persons with disabilities, pero rehabilitation should cover, di ba, parang a lot of people at all ages in all settings. So kailangan, maganda sana that if that unit will be able to will be created, then matututukan yon na yung ibang bureaus may involve nga from the health facilities to the local health systems. Pero important rin, so si DOH ang national, parang national resource or national advisory, pero dun sa local system may counterpart siya na may ensure. So I think sabi niyo naman doon na parang naiisip niyo within PDAO there would be. So magandang we build up on that, and then I agree also with what Doc Penny is saying na though rehabilitation may seem na initially something health related, but for us to be able to provide that, we need to really make sure that there are involvement of other government agencies. So yeah, yun lang po. So
yeah, so I hope ito yung start lahat ng mga rehab professional groups ay mag-join together at walang papayag na may maiiwanan. Okay? Yes. Yes, Candice.
Hello, good afternoon po everyone. So I agree with what Doc Ferd said earlier, which is to really mobilize the other government units, because as of now there are a lot of existing programs for PWDs. However, parang hindi pa po siya cohesive. Like for example po, there are certain city health offices that already provide clinical services to pediatric and also adult and adolescent people with disabilities. Aside from that, we also have the DSWD providing early detection, prevention, and intervention of disability for certain regions po in the Philippines. So there are already certain structures here. I think that we need to just empower them and also equip them with the current knowledge po. Aside from the accessibility issue po, I would like to just suggest a certain trend po in the rehabilitation sector and also po in the ADHD society. So we are able to actually connect with a lot of people with ADHD throughout the Philippines, Luzon, Visayas, and Mindanao because of the internet. So a lot of our support groups are often held online, and these are facilitated by ADHD coaches, SPED teachers, sometimes occupational therapists, and also speech and language therapists. So maybe we can also include in the rehabilitation unit, as proposed, telerehabilitation po. Maybe that's a nice thing to explore. That's all pa lang po. Thank you.
Carmen,
Thank you.
can you hear me? Carmen, can you hear me?
Hi, yes, ma'am.
I apologize for intervening. This is Rowena Guanzon, your representative in Congress. I am very happy that Carmen, Grace, et al. Succeeded in getting all of us together. My welcome remarks is quite late, but you know you're all welcome in my heart. As I listen to all of you, I feel like I'm in PWD 101 class because I am starting from the beginning. I am hearing so many things for the first time. So I am always available for meetings and consultations such as this, of course, with our consultant Carmen and our chair, Grace Yaneza. And again, many thanks for joining us today. I will certainly read the transcript or listen to this video again in full. In the meantime, I just want to inform you that I want a meeting with the PhilHealth officer in charge, of course, with Carmen, and perhaps one of you, an expert on PhilHealth services and regulations, because this is something that really PhilHealth has to comply with under our law. So again, thank you very much. I'm just listening here. Keep on talking. I love you all.
Thank you po, ma'am. Thank you po, attorney. Okay. So, okay. Thank you. Prissy, go ahead.
Hello? Ayan, narinig po.
Yes.
So, yung sa akin naman po, regarding po ito sa adults naman with adults with disabilities, kasi nakita ko po dun sa proposal, I guess okay naman po yung sa children. Regarding po sa adults with disabilities, ang concern ko po is the reintegration to the workforce or sa labor participation po ulit ng mga adults with disabilities who acquired disability or developed disability while in service. Kasi po, as of the moment, we do not have a particular government agency or a certain entity, for that matter, who can actually assess the the new capabilities of those persons with it na nagkaroon ng disability along the way. Kasi resign or tinatapon sila sa ECC, sa Employment Compensation Commission to get assistance, which is okay kasi magkakaroon ng assistance po. Pero ang pinaka-concern po dito is after the diagnosis and after knowing what's left in them. Kasi ang gusto natin, di ba po, ang end goal naman natin is for persons with disabilities to continue their employment, especially if they're very capable after sabihin na natin na officially sinabi na meron na talaga siyang permanent disability or lifelong disability. Ang pag-rehab new situation is a combination din, hindi lang po purely medical, but there is also adaptive skills. Kasi yung adaptive skills po ay makakatulong sa kanila for the reintegration in the community or reintegration in most especially in the labor force. We have public servants or we have persons with disabilities in serbisyo sibil na may ganito pong mga experience, no? They opt to retire because they are not welcomed anymore in the labor force. So this is one of the gaps that we found out when we are doing the inclusive employment policy reform in one of the government agencies, that there is no official entity yet that would actually assess this kind of situations where it's well measured, it's well assessed. Hindi lang po yung medical or medical diagnosis, pati po yung mga adaptive skills na kailangan nila for reintegration in the labor force, either by circumstances or by their actual organization. Dahil ang gusto natin, makita pa rin sila ng sistema or ng organization as fully productive individuals or fully productive employees, even if they already have a disability. Usually po, ito yung mga napupunta sa mga adults na yung mga along the way na nagkaroon kasi as we ability po kasi is very unpredictable so in the middle of their lifetime. Ito po yung kailangan naman namin sa employment, the labor force, by ensuring that they um, situation. And yun nga po, marami po kasi tayong they have to suddenly stop. Like teachers.
Okay. Hazel? Hazel, okay.
Hello po. Ayan po. Sorry
Ah.
po. Ako
Tapos
po
naman
yun.
si Quincy?
Ako po yun. Si Chrissy.
Okay, go ahead, Quincy. Tapos ka na?
Ayun po. Ayun po. So, bali yun lang po. Hindi ko po sure kung narinig po lahat ng sinabi ko kasi parang may internet problem. But, yun nga po, no, yung reintegration po sa labor force ng mga ganang situation. And, sorry to add lang po quickly, kasi na-mention po kanina or napag-usapan po yung pagkakumpleto ng workforce sa rehab. Hindi ko po sure kung technically or officially member po ng rehab community yung mga nagtuturo sa adaptive skills. Well, nevertheless, kung hindi man po sila officially part nun, baka po merong provision na pwede ma-insert dito sa proposed bill na itong mga nasa adaptive skills can be included as one of those workforce that will help the reintegration in the labor force. Pero non-medical po sila, but they are part of the adaptive skills in the reintegration. Yun lang po. Thank you.
Okay. So, Hazel? Okay, go ahead, Hazel. Wait, sinong mag-voice kay Hazel?
Brian, ikaw na po.
Okay, go.
Yeah. Good afternoon po.
Meron na Ma'am Carmen, somebody speaking.
Hello.
Yes, somebody
Audible
speaking.
po?
We can hear you.
Good afternoon. Good afternoon, everyone. Thank you, Ma'am Carmen, for inviting me here, this consultation. So I am really happy. And my name is Hazel Ambual Damor. Yeah, Damor. Bual Damor. From Cagayan. Cagayan de Oro. My position is council member of PWD National Anti-Poverty Commission, Anti-Poverty Commission. So now, with your sharing, and I want to share my experience in the deaf community. It is true na marami po talagang kulang. And for example, sa accessibility and then sa rehabilitation. Why? Because yung sa lalo na po sa mga depression, na-experience to, and then yung sa mga children, mga deaf children. And then third, mahihirap po na family. Wala silang pangbayad sa medication. So, nadidepress po talaga sila. Yung sa hospital, walang interpreter sa hospital. So, how can they pay? And we need rehabilitation for with interpreter. I hope merong budget for hospital with interpreter. And then in sa deaf consultation, yeah, consultative. So we really need consultation, especially in terms of sensitivity, meaning, and then especially promoting sign language. Same with the hearing. Very important po sa amin itong consultation. Plus, I hope there's interpreter. It's very important. So we really want to help each other, and especially and then the deaf community for the rehabilitation. Thank you po.
Okay, thank you, Hazel. Okay po. So, meron pa po ba tayong mga comments, recommendations, suggestion about our document? Recent lang po. We still have time. Okay, yes. Right. Yes, Henrik.
Hello po, good afternoon, ma'am.
Introduce yourself.
Opo, good afternoon po sa lahat. Thank you po sa invitation. Thank you po kay Congresswoman Rowena Ganson, kay Attorney Bing. Thank you po, ma'am. Ako po si Hendrik Dakuyan po. Recently, I was the newly elected National President of the National Federation of Persons with Disability po. Pero meron pa po akong isang organization na ako rin din po yung nagtaguyod at ako din po ang presidente, yung pambansang pulisya po ng ating bansa na nagretiro po ng maaga through disability. Ito po yung PNP, Total Permanent Physical Disability Retirees Association Incorporated po. Ang gusto ko lang po, ma'am, yung concern ko lang naman po dito, based on our experience bilang mga pulis na nabalda in line of duty, yan po yung kulang dito sa ating pamahalaan, kasi nga po yung sa amin na nababaril po, nasasabugan ng granada o ano-ano pa man, yung iba papunta ng trabaho na babangga yung sasakyan, talagang after namin mag-retiro through disability, wala na pong programa yung gobyerno para sa amin. Kung meron man po meron kaming rehabilitation, pupunta ka pa po ng PNP Krami General Hospital. Ang lalayo kung gaya namin dito ko sa Eastern Visayas, yung iba nasa Mindanao. So po kaya walang nangyari sa amin na ang feeling po namin talagang pinabayaan kami ng gobyerno. Despite of that na talagang we have been incapacitated in line of duty, binigay po namin ng lahat yung service namin para sa bayan. Yan po lang, ma'am, yung una ko munang concern mo tungkol po sa rehabilitation. Thank you po.
Okay. Daming namamatay kaagad mga spinal cord injured na mga pasyente. Pag umuwi ng bahay nila, ang ikli ng buhay kasi wala nang rehabilitation, namamatay sa bed sore. Yun ang masaklap. na masaklap na resulta ng kakulangan ng rehabilitation, even yung mga stroke victims na bumibigyan lang ng immediate rehab, matagal pa yung buhay nila, mag-i-increase yung functionality, nawawala na, instead, nade-depress doon na sila, umiikli ang buhay. That is why napaka-importante talaga nitong batas na to, no? Itong rehabilitation for all. Kasi ang iniisip lang natin na nangangailangan na rehabilitation, yung mga nagkasakit na. Pero hindi natin iniisip yung mga tao na aging sila at nagdi-decrease ang kanilang mga functionality in all senses, hindi lang mobility. So, kaya nga ating isinusulong ay talaga yung rehabilitation for all. At ito dapat ay binibigyan natin ng pansin because a strong nation needs people who have strong functionalities. At kung mai-increase natin ang functionalities ng mga tao, mapapawasan yung mga welfare cases, di ba? Instead na makakapagtrabaho sila, instead makakapag-work pa sila, makakontribute sa economy, yung konting serbisyo na magpapalakas sa kanila ay parang ipinag-akain at pinanghihinayangan pa na ibigay. Like, ngayon, ang ating mga assistive devices, outdated pa rin. At hindi tayo agad-agad makapagbigayin ng tamang mobility aids and other assistive devices because, wala yung interpreter ko. Ayan. Okay. Because hindi sila nakakapunta sa mga rehab service providers para maintindihan nila kung paano may increase yung kanilang mga functionalities na nawawala. So, yun po. Okay. So, ang next po natin na bibigyan din natin uli ng discussion ay yung etong paano natin maipupush yung registry, yung mai-register tayo sa PhilHealth. Kasi sabi dito, hindi although ang sabi sa batas, automatic lahat ng person with disability ay member ng PhilHealth. Yon. Automatic yun na member ka ng PhilHealth basta may disability ka at nakita ang pangalan mo doon sa Philippine Registry. So kapag hindi ka na-upload sa Philippine Registry, kahit may ID ka, hindi ka mababudgetan na ang PhilHealth. Okay? So Marco Ramos. Go ahead. Sino to? Si Eric ba to? Marco, naka-raise yung hand mo. Go ahead.
Sorry, Ma'am Carmen. Sorry po, wala akong video. Bagong gising po ako.
Okay, sige, go ahead.
Yun po.
Si Eric Marco?
Yes, ma'am. Si Marco po,
okay,
yes.
Sige, Eric.
So yun, siguro po, susugan ko lang, I just like to follow up with what Chrissy said earlier. On kasi parang I think one gap I'm seeing is it's not the framework of rehabilitation and habilitation so far isn't clear. So I think there should be a delineation if there needs to be one in the bill. Because as of now, with the way that conversation is going, it looks as if we are zeroing in on rehabilitation and habilitation as a medical components of the program. And Chrissy brought up and Caesar from who also mentioned, hindi ko po na-pick up yung name, Caesar po na nag-mention from colleagues from the PNP who were who became disabled in the line of duty. I think meron tayong there should be a delineation saan papasok yung disability support services and independent living services in this framework of rehabilitation and habilitation. Because as I've mentioned so far, as the conversation is going, we're zeroing in on early diagnosis, prevention, and intervention. So parang I do feel like that should also be delineated. Number two, siguro a part of the bill as well, and I think this was also mentioned by Doc Penny sa chat earlier. I think we should clarify from which perspective are we looking at the issues. Like for example, using disability inclusive language in the bill, because there would be implications on there would be implications on regarding the language that we use and how this all plays out, lalo na pag it's all laid down into the bill. So I think may point din po si Doc Penny earlier, which I would have to reiterate is using disability inclusive language, kasi ang laki ng impact niya doon sa direction na tatakbuhin ng bill, especially as it is being written. Yun lang po, Ms. Carmen. Thank you.
Okay, thank you, Eric. So, yan. Well, siguro nga, no, we really have to distinguish kasi nga, even in the World Health Rehabilitation 2030, they really talk only about rehabilitation for all people, but not habilitation. Kasi parang after na makuha mo yung ma-increase mo yung functionality or magkaroon ng support ang functionality mo through a treatment of assistive devices and rehab service, doon magsisimula yung habilitation. Or habilitation can be a part if you are born a person with disability. That means coping or growing up with disabilities. So, and that yun yung habilitation part na either wala kang medical rehab intervention, or after medical rehab intervention, then you start your habilitation process. So yun yung parang difference, no, yung ng habilitation and rehabilitation.
Carmen?
Kung tama. Yes?
Yes,
Sige po.
si Butch ako, si Butch.
Hi, Sir Butch. Sige po.
Carmen, di ba tayo may pidaw na tayo eh? Yung registry, sa registry, kasi medyo critical yung pagdating doon sa sinasabi mong magiging recipient. Bakit? Kahit meron tayong law, meron tayong IRR, kaya lang hindi lang fully implemented. Bakit hindi natin ipadaan doon? Sali na natin sa bill na yan na ang lahat na persons with disability, ipapadala ng PIDAW. Kasi it's already a law. There's already an IRR. Padala na sana ng PIDAW na local sa PhilHealth para matapos na yung usapan tungkol sa registry. Kasi marami talaga hindi nakasagin. Kahit dito sa amin, ganun din. Kasi hindi na sila nagbabayad PhilHealth because they've already assumed that they are members. Kaya lang problema nila, pagdating naman doon sa sinasabi mong registry, wala sila. Wala sila sa amin. They have to go to the office, the PhilHealth office. Pupunta pa sila doon.
Okay po. Kasi, yes, Sir Boots, thank you very much for your inputs. No? Ang problema po kasi natin ay ang nakalagay po kasi sa batas ay yung database ng mga LGU dapat ay ma-upload doon sa PRPWD o yung PhilHealth Registry of PWD, which is very impossible. Dahil maraming mawawala. Whereas kung i-amend nila yung process of registry na PhilHealth na lang offices ang kumuha ng data o doon iparehistro na lang ang mga person with disability doon sa PhilHealth offices in their LGU, mas mabilis.
Totoo naman yun. Pero, totoo yun. Pero, ito ang problema. Yun nga sinasabi ni Atty. Gonzon, ni Congressman Bing.
Yan nga po kaya aamin natin.
Yun bang tao anya na putol ang paa, papatindigin mo ng 2-3 hours para makapila. Ako, I did try. Noon, nag-try ako. Ako, senior na ako, PWD ako, pero pagpunta ko doon, I still had to wait. Iniwan ko na. Kasi 2 oras na ako doon. Iniwan ko na. Iniwan ko na talaga. Kasi hindi naman ako talaga. Kaya lang, gusto ko lang sana ipakita doon sa mga kasama ko na we can do this. Kaya lang hindi talaga.
Yes.
Hindi talaga. Kaya nakakaano na. Kaya sabi ko,
po ang experience sa mga iba-ibang lugar na kapag walang talagang hindi maliwanag yung national policy, mahihirapan po talaga yung mga nasa LGU para mag-comply. Ang ngayon, ang pinaka-urgent problem ay paano tayo makakasama doon sa PhilHealth. Paano natin makukuha yung mandatory PhilHealth coverage na yung PhilHealth mismo ay mahahawakan yung data tungkol sa atin at sasabihin, eto, 500,000 PWD ang nakuha namin at sila yung aming babadgetan. Which is unfair sa ibang lugar, no? Kasi yung 500,000 na hawak ng PhilHealth ngayon, hindi po yan na nagre-represent
hindi. Tama yan.
sa mga number ng PWD nationwide.
Tama. So, sana itong PIDAW ma-fully implemented.
Ang PIDAW po natin, hindi lahat ng LGU may PIDAW.
Tama.
Kaya dapat po talaga yung ating policy ay maliwanag na talagang yung PhilHealth, kayo ang gumawa kasi mandatory yan sa inyo, mandatory coverage.
So through what? Through what? CDRS?
Kailangan kasi una, ma-amend yung batas na nagsasabi na PRPWD ang magiging basis ng ng coverage. Dahil ang PRPWD ay napaka-discriminatory dahil hindi lahat ng LGU ay makakapag-upload ng data. Samantalang lahat ng LGU ay naililista ng PhilHealth. Yun lang po yung natin, yun po yung ating dapat na yung ating dapat na ilabi na kung kaya ng PhilHealth na ilista ang lahat ng PWD sa lahat ang mga recipient nila sa iba-ibang PWD, sa iba-ibang LGU, dapat sila na ang mag-initiate na kuhanin ang data ng PWD.
Carmen, yun ang ating local PIDAW. Hindi pa kompleto. Yung ibang mga munisipyo, totoo yung sinasabi mo. Less than half, I think, ang meron PIDAW na function. Less than half na function. Lalo na siguro ang PhilHealth kung siya ang magagawa nito. Kasi gagawa naman siya ng panibagong opisina just to do this.
Well, actually, pwede rin sila makipag-coordinate sa mga PIDAW or sino man yung nag-i-issue ng IT. Parang mas madali yun kaysa mag-upload ka, maghahanap ka ng account, tapos hawak mo na yung listahan, hindi mo ma-upload.
Tama.
Ma'am Carmen?
Yes, searching yan. Yes, searching.
Oh, I remember before, Ma'am Carmen, when you were NCA director, parang nagkaroon kayo ng activity with the COA, no? Commission Audit, regarding, di ba pag hindi sila sumusunod ng mga laws, pwede silang kasuhan yung mga government agencies na apparently parang hindi rin keen on doing that yung COA, no? Na to flag agencies that are not following disability laws. Kasi kung sa law lang naman, I feel na parang marami na tayong mga laws. But then, yun nga yung full implementation ng problema.
Ang COA kasi, searching, halimbawa, nag-budget si PhilHealth, hindi niya ginastos, saka talaga sila pwede mag-enter at saka tayo pwede mag-complain. Pero wala namang budget concern. Pero ang negligence of law,
gross negligence kung isipin.
Yung gross negligence ng law, yan po ay ombudsman ang filing natin.
Yun na nga, if we can do that, maybe pwede example ng isang agency, di ba? Kasi it's been for a long time now mga PWDs are being deprived of their rights.
Right. Opo.
Kasi may kasabihan nga disability contributes to poverty and poverty can contribute to disability. Ganun ang kwan eh.
Opo, tama po yan.
Karamihan po ng PWD community, nasa 95% siguro under the poverty line. So, I think it's high time na, and we're very glad nga na nagkaroon na tayo ng party list under Congresswoman Rowena Guanzon who will fight for us, di ba po?
Opo, kaya nga po ngayon ang ating mga discussion ay may patutunguhan naman dahil i-analyze natin mabuti ano ba yung mga ano ba yung we will talk about solution through policy.
I am not a lawyer, Ma'am Carmen, pero I think there should be a penalty clause. I'm not sure if I'm right na if they don't follow these laws, they should be penalized, di ba? Parang ganun eh. Kasi mga citizens tayo and ordinary citizens, pag may binayolate kang law, pakasuhan ka kaagad or, di ba? Why is it not that...
Itanong natin kay Attorney Evans kung ano yung procedure, yung si Attorney Evans.
Si Congresswoman Binguans.
Yung legal staff ni Attorney Guanzon, siya po yung naglalagay ng ating mga bill into proper format. Attorney Bam, mag-good afternoon ka sa kanila, please.
Hello po. Ako po yung former legal head ni Commissioner Guanzon.
Okay. Yan. Ayan si Attorney. Attorney Bams, wala ka bang video? Ayan. Okay.
Kasi mahina po yung internet.
Okay. Sige po, Attorney Bams. Sige. Ayan. So, si Attorney Bams po yung legal staff ni Attorney Guanzon. Ano po yung tinatanong nyo, yung paano mag-file ng searching?
Yung mga laws kasi parang napapansin ko, yung nababasa kang mga laws, wala siyang parang penalty clause, di ba? Parang, am I right na part of a law should have that or hindi naman?
Depende po kasi yung mga laws usually may mga penal clause sila. So sa penal clause doon nakalagay yung mga penalties in case na violate yung provisions of this law. May mga karampatang penalties. Pero kung wala namang penal clause yung law, kahit na violate siya, pwedeng wala pong consequence. So we have to look at the law po. Kung may nakalagay doon na penal clause. Kasi
Can we introduce penal clause?
Pwede po din kasi yung penalty is parang fine lang siya or minsan may kasamang imprisonment, something like that. So we have to look po kung ano yung law na na-violate, and then let's check kung may penal clause siya.
Kung wala po, pwede nating dagdagan ng penalty.
Pwede po tayo kung wala pong penal clause or kung walang penalty na naka-indicate doon sa law, pwede tayo mag-propose ng amendment para to include penalties in case of violation of those provisions. Para po magkaroon siguro yung sa enforcement and implementation of the law.
Kasi we're being deprived of our rights, and that's a very big kumbaga kasalanan, ano?
Yes.
And
like
yeah,
yung
we
sa
are
proposal po natin, ang alam ko kapag may na-violate sa, like for example, yung second bill na na-file ni Congresswoman Guanzon, may dinagdag tayong penal clause doon na kapag parang in certain situations, kapag fraudulent yung pag-apply sa allowance, then may karampatang penalty.
hindi lang siguro fraudulent sana. Dapat yung negligence, di ba?
Yes po.
Gaya nitong PIDAW law.
Account po kapag in
yung
drafting
PIDAW law.
bills.
Yung, may nagko-comment ka na very small daw yung kasi linalagay na penalty.
Okay po, Sir Ching, ano na natin yan? Lalagyan na lang natin ng mga penalty, heavy penalty clauses, yung mga bills na ating ipapile.
Yung napapansin namin, Ma'am Carmen, even yung di ba yung White Cane Safety Act law, which is
Opo.
which is around 30 years na rin yan 30, at the same time with the American Disability Act, kasabay yun na enact into law But
Nagnak-arta yun, nagnak-arta.
hanggang ngayon, full implementation, wala
Okay. Yes. Sige po, gagawa
Because there's
natin
no
ng paraan
penalty.
yan. Gagawa natin
Gagawin
ng
yun.
gagawa natin ng way para yung mga batas na hindi na i-implement, kailangan implement nila na nanginginig pa. Okay po.
Kaya maganda nga po na nandyan si Congresswoman Guanzon kasi matapang siya
Yes po. Yes po. Sige po, Sir Ching. Thank you. Now we'll call
you.
on PIDAW National Area.
Hello po, magandang hapon po sa lahat. Salamat po sa invitasyon. Ako'y nakalit dito sa usapin. Gusto ko lang po iparinig ang aking stand, yung position o tungkol sa PRPWD. Bilang PIDAW, talagang nakikita namin na nagdang pahirap po ito, ma'am. Sana po talagang makuha natin ng pulso ng malaki ng signal. Talagang nahihirapan po ang mga PIDAW sa pag-upload ng mga pangalan ng ating mga kasamahan sa PRPWD. Ito ang hindi ko maintindihan bakit kailangan talaga merong ganito. Sa lahat naman ng sektor, ang bilis sa PhilHealth. Yun pa talaga ang mas pinapahirapan para sa pag-register ng PhilHealth. Meron namang listahan ng PWD ID holder ang lahat ng LGU. Bakit hindi na lang yun? Ang listahan namin ang isubmit noon sa PhilHealth at kung meron mo kailangan.
Tama, di ba? May PhilHealth naman sa inyo, di ba? May PhilHealth office sa inyo.
Oo, meron. Dito. Malapit na. Meron kami coordination. Kaso talagang parang napabaliwala yung PWD ID, napabaliwala yung PhilHealth office, kasi kailangan pa ng PRPWD.
Okay.
Masyadong nagiging powerful ang PRPWD. Noon naman sa accessibility, tama ko yung sinasabi doon sa group chat, na i-review natin yung function ng mga building official. Parang nakutulong yung iba. Pwera na lang yung mga gumagalaw talaga. Kasi talagang nakakakayo, bakit merong pumakaka na mga building na hindi naman accessible? At bakit pumakaka yung mga ramp na masyadong makirik na hindi naman compliant doon sa required na measurement? So kailangan anuhin natin yung mga ganyan, yung nabibigay ng license to operate. Tapos yung tungkol naman sa Pinauno, ama ko yun ang mga observation ninyo. At kahit meron ng baka, meron ng IRR, ang RA 10070, kahit required na siya. Pero ramdam natin na parang optional pa rin sa local government unit. Bakit? Kasi sa namin proyekto, minsan pinipili talaga ng local executive na i-ignore na lang ang PIDAW. Dahil wala namang mawawala kung hindi sila mag-implement. Kasi feeling nila wala namang sanction, wala namang penalty. Ano ngayon kung hindi sila kumata, wala namang mawawala. So, akala nila yung buti yung capacity ng mga person with disability, hindi naman nakakatalo sa kanila. Kunti lang naman yung numero. So, yun sana ang tinitingnan. Sana magkaroon ng penalty na medyo mabigat talaga. With Attorney Wanton at Ma'am Carmen in tandem, talagang masyado malaki yung expectation namin na nakakagigil na talaga yung mga hindi nakikinig. No, talagang pagod na tayo sa mga ganyan.
Ngayon, Miriam, kapag hindi na sila nag-implement ng PWD program, magbabayad sila doon sa Disability Empowerment Fund. Dahil halimbawa hindi ka nag-implement ng at least 2%, ay 2% ng budget mo ay i-contribute mo doon. Bawas yan sa current budget, at kapag hindi ka pa rin nag-implement, every year may bawas ang budget mo.
Yun. Tama. Yung mga ganyan, tama ko yan.
Yeah. So hopefully, pag-anahan natin yung empowerment fund through the Disability and Development Support Fund. Yan yung, and that is also strengthening NCDA into a commission.
Okay. Maraming salamat po, Ma'am Carmen and Congresswoman.
Okay, thank you. And now po, ang ating po huling exercise ngayon ay isulat po ninyo sa ating chat box ang yung mga proposed bill ninyo, yung mga issues na gusto nyo na talakayin natin. Dahil hindi pa po tayo tapos dito sa national, At hopefully ay pag nag-convene po tayo uli, ang mga naka-line up po nating discussion ay yung amendment ng accessibility law, etong disability, itong empowerment of person with disability through through Disability and Development Support Fund, saka po yung Disability Support Allowance. So naka-line up po yan, ipopose lang po natin. At siguro mas maganda kung tayo ay mag-express kayo ng mga committees na gusto ninyo na salihan para doon tayo para happy-happyin natin ang group, para pag tayo ay nag-meet uli ay output na po ang ating i-discuss. Okay po, at any suggestion po?
Suggestion lang po, Ma'am Carmen, yung maraming suggestions ako nakikita sa chat kung pwede ma-record yun kasi I think maraming nag-contribute din through chat. Kung hello?
Yes, opo.
Baka pwede,
Lahat
pwede,
po na to ay
pwede,
i-review po namin itong mga chat na itong mga recommendation sa chat, no? Yan, like we have to come up
Marami po
with
nag-contribute
yung
doon.
no, maganda tong suggestion mismo na we will have a Google folder, no, na where if you can wherein you can react, you can comment, you can recommend doon sa mga bills na ating dinadraft.
Thank you, ma'am.
Opo. And yes. Yan. So marami po tayong mga lahat po ito ay ino-document po natin to at nagkakaroon bawat meeting documentation po natin ay ilalagay natin sa ating Google folder, sa ating Google Drive folder para po lahat ay may access. Okay po. So yun po yung ating mga ano ngayon. So, kung meron pa pong we still have 10 minutes. Kung meron pa po kayong mga suggestion, yan po ay you can talk at least 2 minutes para po maraming makapagsalita. So, anybody? So, yan. Okay po. So, kung wala na po tayong, kung wala na po mga suggestion or comments, so rest assured na lahat, ito pong ating, itong ating forum ngayon, consultation, ay naka-record po ito and will provide you with a copy.
Ma'am Carmen?
Yes po.
Ma'am si Hendrik po. Ma'am,
Yes,
pahabol lang
Hendrik.
po yung aming concern po, yung sa bill na binigay ko po sa'yo. Baka
Ay,
ma-review po.
oo, yung ilalagay, pag-uusapan pa namin, isasubmit ko pa yan kay, Attorney Watson. Pero alam na niya yan.
Apo, sige po ma'am.
Inaayos
Baka,
ko na.
kasi yung sa posthumous survivors po mo, doon po ma'am, hindi po siya napasama. Baka po pwede pa tayong magkaroon ng kunting dialogue po tungkol po doon sa bill ma'am.
Okay, sige. Siguro, we can have a special dialogue with the PNP retirees and survivors, no?
Apo, thank you po ma'am.
Okay, sige. Okay, anything else? Meron pa po kayong gusto i-share? Yan. Yes, we will create yung mga volunteers, i-collect po namin yung mga mga preferences. And we will, yung mga hindi, lahat po ng mga lahat ng mga na-share natin doon sa group chat, lalagay po natin lahat chat sa ating Google Drive. So, okay po. So, siguro po dahil, andito pa ba si Ma'am Bing, si Congresswoman?
Mukhang nawalan siya ng internet.
Nawalan na siya ng ng data. So, sino na po ang so for closing, ating closing prayer, can we call on, si Pastor Ching to lead us to but before we close with a prayer, tawagin din po natin ang isang board member din ng PWD, si Ma'am Marian Pulyon. Ma'am Diday.
Yes, I'm here.
Yes.
Ano ulit sabi mo? Sorry.
Closing remarks po.
Okay. I was not prepared to be so learned, ang dami kong natutunan ngayon. Wala pang 15 minutes. ang dami ko nang natutunan. Parang ito sa whole learning experience, hindi ko akalain na gano'ng karami ang aking matututunan today. But at the same time, I've been very humbled by the experience and I'm so happy. Yung nakaupo ako dito, nakikinig. Yung talagang, kuminsan alam niyo yun, you're in a group, you're listening, and all of a sudden you realize, yeah, this is for me. Ito yun eh. Ito talaga yun. Kasi ako, mother ako ng isang Down syndrome na 17-year-old. Okay? So, obviously senior din ako. Pero more important, yung PWD ko na anak na may Down syndrome tsaka meron din siyang epilepsy. So, I'm sure it's been such a humbling experience today, and I'm so grateful that lahat kayo, you have been so sharing, you have been so giving of yourselves, and I admire the courage, the strength of everyone na talagang lumalabas pag nagsasalita kayo. So maraming salamat. Maraming salamat.
I second the motion. Really. We have a lot of work to do, but we're here. We're all here.
Yes,
and we are all willing to give of ourselves para sa ating mga kasamahan na may pangangailangan. Yes.
Yes, Grace. Thank you very much po, Ma'am Grace. So we can now call on Sir Ching for a closing prayer. Sir Ching?
Yes?
Closing prayer po.
Ako ba?
Opo.
Sorry. Lord, thank you for this opportunity today that all persons with disabilities are gathered together in our common goal to uplift the standard of living of persons with disabilities in the Philippines, and to be able to discuss some solutions, possible solutions and rules and laws that would help us go through life and live the life that we want. We pray in Jesus' name. Amen.
Amen. Thank you very much.
Thank you, everyone.
Maraming salamat. So, pwede ko bang mag-on ng camera para po sa picture? Camera on po.
Camera on.
Para po meron tayong yan. Okay. Yes. Sana po bang mag-on ng picture? Yan. Okay po. 1, 2, 3, smile. Okay po. Second page. Okay. 1, 2, 3, smile. Yan. Okay po. Thank you very much.
Thank you so much, everybody. Salamat, Carmen. Salamat.
Keep in touch
Thank you.
po. Thank you, Ma'am Grace. Thank you, Ma'am Maylay.
Maraming.
Thank you, Ma'am Carmen.
Thank you
Ma'am
po.
Carmen, salamat.
Nice to meet all of you.
Ganito dapat.
Salamat, PWD.
Yes.
Ms. Carmen, susunod, physical meeting na.
Opo, susunod po after ng zona. Pinaschedule po ni Congresswoman.
Yeah.
So, we will inform you po.
Great.
natin ilalahad yung lahat ng bills na ating
Yeah.
yung lahat ng bills na ipafile natin ng sabay-sabay with audience.
Correct.
Bye, Miss Carmen. See you soon.
Okay,
Bye, Sir
Mama, Miss
Idol.
Juana. Thank you.
Mana. Nice to see you.
Thank you very much.
Bye.
Thank you, Ma'am Grace and Ma'am Diday. Thank you very much. See you po ulit.
Sa iyo talaga.
Yes, Ma'am Grace.
You should meet.
Sige, ma'am. Usap tayo ulit. Tayo lang. Saka si Ma'am Didoy.
Okay, bye.
Bye. Ako, hindi ko na makita.